It's Krista and Jessica. We're here coming from Relief Parenting Respite and Resource Center in Hampton, New Hampshire. Wanted to do our second long distance relief with all of you. Thanks so much for joining us last week. Again, I'll introduce myself. I'm Krista Malte. I'm an advanced postpartum doula and postpartum doula trainer with Dona International. I'm an advanced lactation counselor, also mom of 2 little boys, and the general ringmaster of this crazy show. And this is Jessica.
I'm Jessica Holt. I'm a postpartum doula and lactation counselor here at Relief. And we're really excited.
Definitely.
Second Facebook Live. Woohoo! Let's see if we can do it twice.
So today we thought we'd kind of start the ball rolling with just kind of checking in with all of you. So where are you coming from? How old are your little ones? And we'll just kind of check in and see where everyone's going from here. We really appreciated last week. We got some great questions about breastfeeding, working from home. What else do we have some questions about? I don't even remember.
That was last week.
We're
moms. We can't remember last week. Come on.
I'm feeling tired today.
Yeah.
Is anybody else feeling tired today? Like, throw a little Bitmoji out there about like how you're generally feeling. Or
it's Wednesday. It's okay to be tired on Wednesday, right? Like halfway through the week.
I'm generally, yeah.
That's
really why I created this space, is because I know I'm tired. I'm sure other people out there are tired as well. But we wanted to talk today about kind of employment and parenthood.
One of the things that makes us tired.
One of those main reasons that we're all so tired, right? Because parenting is a full-time job. It is definitely 24 hours a day, 7 days a week, nonstop. And so we thought we wanted to just kind of give some tips and try and see if we could bring some relief to parents, especially if you're currently at work right now. So if you're at work, shout out and say hi, and hopefully you're also getting some food and maybe something to drink as well.
So let us know how long you have taken for leave from work, when you went back to work, if you're working from home. Kind of let us know what your situation is, if you're out on leave now, or I took 13 weeks with my son and then went back very begrudgingly, but I went back to work, and I pumped at work for almost 2 years, which was a lot of pumping, a lot of time in that pumping room. So let us know, where you're coming from and where you are.
Yeah, and I've always been self-employed. So when I first started having my boys, my oldest is 5.5 and my youngest is 2.5. I was working as postpartum doula. So I was self-employed, and I took probably, I think, about 6 or so weeks off before starting to see a client again, and then realized pretty quickly I was in too deep and kind of backtracked a little bit, and then stayed home with my son, and actually watched one of my dear friends also had a baby the same age. So kind of did some in-home childcare and did that for probably about a year or so, and then slowly started getting back into working as a doula. So I've kind of done the work outside, work at home, and obviously now having the center, lots and lots and lots of work. So as an entrepreneur. So I also have one of my sons here, and my other son is at school. So yeah.
Second week of kindergarten, huh?
Yes, going well, which thank goodness he's very excited.
Fingers crossed.
Exactly. He really enjoys his school, which is great.
Yeah. One of the biggest challenges, I think, with going back to work that people face is finding childcare.
Absolutely.
Scheduling, sick kids. What do you do? I was really fortunate that I work in a hospital, so I was able to go back nights, and my husband and I work opposite shifts. I don't know if anybody else out there is kind of in that boat too, where they're not really seeing their husband a whole lot, which is, we're now, 4.5 years in, and we've got 1 year left before kindergarten, and it's like, oh, we'll actually get to see each other again and spend more time together. And we kind of were under the idea that okay, we had a lot of time before our son. We're going to have a lot of time after. This is kind of his time where we're going to sacrifice our time together to, make this work for all of us. And it's been really hard.
I imagine so.
We actually got to get along better when we see each other more.
Well, sometimes I hear so much. It's like I feel like so many people are passing ships in the night, right? It's like, oh, I know you're there. We might see each other. You might lay next to each other in bed, but okay,
or
bye.
not,
or not. In your case, definitely.
I get home at 2 a.m. and he wakes up about 5:30 in the morning. So we are ships in the night, really.
Quite literally.
Yeah. So we definitely have to make our time count together when we have it. So,
and I think that's an important kind of theme that I'll keep coming back to a lot today too, is just that quality over quantity, and really knowing that like those relationships that you have with your partner or with your child, with your with older children, that it's not necessarily the amount of time that you're spending together, it's the engagement when you are together that makes a really important difference for people, as you found. So
you can't always control how much time you get with your partner or with your children, but you can control what you do with that time. And that's the thing that we need to remember too, is when we are together, to be engaged and to be there. And
unplug and try and connect with one another in a really real way. So let's kind of start with that childcare piece of things. Obviously, many people who are needing to work outside home need to then figure out, well, what's going on with my baby? What's going on with my, perhaps older child, depending on when you're returning back to an outside workplace. And I think that can be one of the most emotionally, financially, logistically challenging things about working outside of the home, is that childcare piece. So essentially there are kind of three major avenues, right? So the first one would be finding somebody to work, to care for your child in home. That could look like a family member or a friend. It could look like a professional nanny. The second avenue is some form of like daycare type of situation. So like a childcare center, or sometimes the third avenue is then like an in-home daycare type of setting. Am I missing anything major?
No, I think those are
That's pretty much the three options.
Unless you work somewhere like Relief where you can take your child to work with you.
That is very true.
Pretty rare.
It is pretty rare. I think that's why I forgot to include it, is because
it's the very rare unicorn fourth avenue.
Yes. And I really, as I've talked about numerous times, have created an on-premise childcare because I think particularly for young children, we feel so compelled. We're naturally designed to stay close to our children in those, particularly those first early years of life, but workplaces really just don't have the capacity to necessarily do that, or it's not a high priority for them for various reasons. But here at Relief, it was a barrier that I really wanted to try and reduce for a lot of people. So when our employees come to work, they get to bring their little ones. It's very much a dynamic kind of environment where if they're going from, the childcare room over into kind of a play space, they stop by and they give hugs, or maybe need to nurse for a little bit or what have you. But
which you may have if you work at a daycare. You may have that, but other than that, there's not really a whole lot of situations where you see that. I know there are some employers who have childcare in their facilities or next to their facilities, and that can be really great too.
Has anybody had an experience with that? If so, kind of shout out. I know locally there's Bright Horizons is over at Timberland Children's Center. I think
Wentworth Douglas Hospital has childcare.
So there are some places out there, and it does make it easier to just be able to kind of pop down from wherever your office is down to the facility.
But even interviewing a nanny or a childcare facility, it's hard. I found, because we did look at some originally, and before we decided to do the opposite schedule thing, it's hard to know what to even ask or what to look for. So sometimes you don't know until you're already in the situation, and daycare is fill up fast, and the good ones are really hard to get into. I mean, you want the best for your child. Everybody wants to bring their child to the best possible place, whatever that may be for you and your family. But it can be hard to even know what to ask. So if you're out there, what are some tips that you would give a new parent as far as things to look for, things to ask, things that you maybe didn't realize until after the fact that were important to you when your child went to daycare? I know flexibility in time is huge for a lot of people because some places have very rigorous rules about drop off and pick up, and if you're running late or hit traffic, there can be fees involved. A lot of people don't know that until after you have so much information coming at you. And then if you're somebody who doesn't necessarily get out of work the same time every day or is somewhere where there's a lot of traffic, Portsmouth,
Boston.
Yeah, Boston. You can be picking your child up late and running into a lot of fees and things like that. So that's something you want to really know ahead of time. And when you're setting your pickup times, maybe accounting for that. I know that can be a big issue. And then sick policies as far as, when your child can go and when they can't, and really reconciling that with your employer. I know there are some places that have, one place that I worked, you're only allowed 4 sick days in a 12-month period. Now, if you and your partner both work and you have a child who has chronic ear infections or something like that, how are you navigating who's taking the day off to be with the kid? Do you have family members?
Yeah, that's really an important part of things. And a lot of those policies are kind of set by the state in terms of like health code and things like that about, if there's GI issues or if there's fever, things like that, you usually have to be home for at least, another 24 hours after the symptoms have gone away. So it's absolutely something to kind of be thinking about in your back pocket about like, okay, what's the game plan going to be? Or, how do we buffer in some of that? Right.
Do we have family or friends or neighbors or anybody who can kind of fill in those gaps too? So those are things you need to be thinking about ahead of time.
And especially if you're kind of coming in on the early side of things, some people only have just a few weeks off of work and then they're needing to go back in. Most childcare settings, it has to be between 6 and 8 weeks before an infant comes into the room. But really talking to them about what are their schedules like. Are they rigid about things? Do they want everybody to get on the same routine? Do they want everybody to go down in the same time? How do they put their babies to sleep? That's a really big concern for a lot of parents that I work with is, okay, are they just going to be putting baby in the crib and kind of walking away? Do they have the ability to kind of tailor their bedtime stuff or their nap times?
Do they do baby wearing?
Are they are they willing to kind of go with the natural rhythms of an infant, or do they try and again kind of get everybody more on a group schedule? So those are really important questions as well. And I always say, just like listen to your gut. And it's always very nerve-wracking to go into a setting and be like, okay, this is the most precious thing in the entire world to me. Here you go. And so there's definitely going to be some, tension there and some resistance. But I think when it's the right setting for you, it will feel, you'll have some kind of peace about it, and some level of trust. And like all things, I mean, it takes some time to get into a routine. But if you are walking away feeling like, something is not sitting right, and even if you can't put your finger on it, really, really listen to that, because there's so much that you take in as a new parent, and we have just kind of running in our subconscious minds about what's safe and what's not. So, there are plenty of really amazing options. We're really fortunate in the Seacoast area to have so many different childcare options available. And sometimes, again, you might find that a daycare or an institutional type setting just doesn't feel quite right to you. And so that's where exploring perhaps a smaller in-home setting might feel better for parents. And really talking again about what are the qualifications of the person. They don't necessarily need to be licensed or things like that. So really checking in about what's their safety features there. How do they deal with illnesses, so on and so forth. And there are places, again, locally that take in-home care as well. And then the third option about kind of finding somebody to be in home. As a postpartum doula, what we generally see is those first initial weeks and then making that transition into work and making that transition into perhaps having other childcare workers coming into the home. And that's something that we can absolutely help kind of guide through and facilitate as well as postpartum doulas about, looking to baby's cues and helping to educate the childcare worker, helping them to understand kind of the importance of, feeding and what that might look like for bottle feeding, particularly if there's, a mom who's going to be pumping and kind of those unique needs, and helping to kind of maintain that breastfeeding relationship and milk supply. And I think that feeding piece of things is also really important, regardless of where somebody is going to be bringing their child to, because we want to make sure that you've practiced trying to use a bottle beforehand, and there's so much anxiety around that, and understanding kind of what is a typical capacity for an infant. So for instance, just grab this here. We often see these really big giant bottles that are, up to 8 ounces, and really even an older baby generally kind of maxes out around here. So like more like a 4-ounce bottle, particularly if someone is breastfeeding and pumping, you most typically will not be filling a bottle like this. And so anybody out there know or have some comments about kind of why you would want to be educating childcare providers about this? Or any insights as a 2-year-plus pumping mom?
Yeah, I mean, one of the main things is if the baby's not going to eat all that milk, drink all that milk, then you're wasting it, because it can only sit out for so long after the baby has used that bottle. There's bacteria introduced from the baby's mouth. You can't just leave it for the next feeding 4 hours later. It's not okay.
Not even when you put it back in the refrigerator. So as soon as that saliva comes in contact with the milk or formula, it needs to be used in generally within an hour.
Yeah, which a lot of people don't necessarily know. They leave the bottle out and they're like, oh, it's breast milk. It's fine to be on the counter for a couple of hours. True, until the baby has introduced saliva, and then you have bacteria introduced into the bottle. So you don't want to be using that over and over again. So it's better to use more, even though you have to wash them, I understand, smaller bottles, and to have to maybe give the baby a little bit more, top off the bottle from a fresh bottle. That's better than filling up that big bottle and just thinking, oh, the baby will just eat out of that all day. No,
right.
You don't want to do that.
And you can ask, again, the childcare providers and see what their policies are about, can you bring in perhaps one container and then just, again, kind of topping up as need be, especially when babies are adjusting and transitioning to a new space. They oftentimes will kind of go on a bit of a food strike. And so not wanting to take a bottle, not wanting to kind of be eating as much, because again, in terms of priority, they want to make sure that they're safe before they sit down to tuck into a meal. So definitely talking to them about what are the options here and what can we do to kind of make sure that we're maximizing the pumped milk if it's there, or we're not wasting formula, because that can get really expensive. And chatting with them about that. Another really great thing that's out there's some cool videos on YouTube, what's known as paced bottle feeding. And this can be something that you talk about with a childcare provider as well, is do they know what paced bottle feeding is? And anybody out there know what paced bottle feeding is? Essentially what it is if we take, so this is baby Maisie. So one thing that I see really repetitively is we have a lot of information about, breastfeeding, about feeding positions at the breast, but we don't necessarily think about how to really safely bottle feed babies. And so that could be a whole entire big topic with that. But essentially what you want to remember is babies need to be sitting more upright, especially if you've got a baby with kind of an underdeveloped So like esophageal flap there in the back. They can spit up really frequently, or they can, again, just not be able to drink and manage the bottle flow very well if they're kind of in a more laid back or reclined position. Or we definitely don't want to see propping where, babies are kind of put on a boppy or kind of put up and they're like, okay, here you go, and left with their bottle. That's really not safe in terms of airway, in terms of like ear infections, things like that. So we want to encourage everybody to make sure that they're feeding with the baby upright, and then making sure that we're bringing in and really actively asking baby, are you hungry? Looking for those feeding cues. And that's where sometimes, again, if somebody's on a really rigid schedule, they could be missing an opportunity to get to know the baby and what the baby's needs are. And this kind of has longer term consequences of overeating and whatnot.
And by doing that, you really will, your baby does respond to you, and you really do start to recognize those cues by, engaging with your baby in that way. Just because your baby can't speak to you doesn't mean your baby isn't saying things to you. You really need to pay attention to those things too. One of the best things that I did when we started bottle feeding was get slow flow nipples, the natural latch slow flow nipples. And so what that does is it only releases small amounts of milk at a time. So your baby's not getting that huge rush, which is meant for older babies who are more efficient feeders. So if your baby is starting at a daycare or starting with somebody else, where they're going to, or even, if you're eating formula or, like for me, we started pumping right away because my son didn't learn how to latch for about 3 weeks. So he was getting pumped breast milk from day one. So we definitely got those slow flow, drop by drop, and that helped a lot with him not overeating, him not getting too much milk, him not sputtering and choking on milk. That was
it really
a great tip that a very experienced mom told me about. So
absolutely. And generally, what people have a lot of concerns about, oh my gosh, what if my baby doesn't take a bottle? Again, sing out if you've ever kind of had those fears or had that experience. And generally what I have found in my more than 13 years as a postpartum doula is that if a baby is truly unable to take a bottle, there's usually an underlying issue. It could be, again, just something kind of mechanically going on. It could be something kind of from a developmental perspective. And so if you're kind of trying and you're finding, wow, baby's just kind of slurping at it or chomping on it, or just doesn't seem quite to know what to do with this thing, or really starts to get really resistant, kind of like pushing away and batting at it and things like that, that's your baby again trying to communicate. And if we come into the our parenting relationship with the idea and philosophy that our babies are just trying to do their best, they're not trying to manipulate us, they're not trying to be difficult on purpose, it changes the framework about how we interact with them. And so kind of going back to easy bottle feeding, making sure that baby's sitting upright and just kind of saying, hey, do you want to have some of this? And like kind of brushing across the top of their lips, seeing if they start to say, oh yeah, that kind of stuff, or kind of diving for it or opening their mouth. And
just like they would be rooting for the breast.
Absolutely.
Those are the same signs you're going to look for with a bottle.
And then what's really important is we want to tip the bottle so that the milk is in this part here, the nipple part, and we're not seeing air in the nipple. We want to tip the bottle, not the baby. So we oftentimes will say, oh, okay, come on back this way so that the milk goes down.
Have you ever tried to drink in that position?
But exactly. Everybody, if you're like on a lunch break or something right now and you try and kind of sit back like this, and it's very difficult to try and, take a nice swallow. So we want to be able to, again, just say to the baby, all right, like you've got some control over this, and bringing the bottle up. And while the baby's like, getting into that suck and swallow pattern. And then when they take a natural pause, because like everybody, adults as well, we're not just going right down, right? So when they take a natural pause, that's when you drop the bottle back down and say, okay, wait a second. And when they start to, oh, wait, I want some more, tip that bottle back up. And that, again, kind of slows the process down. It helps the brain and the belly to sync up so that way, I always call it kind of that Thanksgiving effect, when you're like, oh my gosh, this is so delicious. I'm just going to have one more piece of pie. And then you're halfway through and you're like, oh, gosh, shouldn't have had that extra piece of pie, right? Yeah. And so we often will just kind of assume that if there's a full bottle, that a baby should definitely be drinking all of that.
Right.
And we want to, again, just give the babies an opportunity to have their brain and their belly kind of sync up and say, wait a second, I'm full. Tell that brain, and then look for those cues of stopping.
Yeah. And this can be another time. We talked a little bit earlier about quality time versus quantity time. This may be a time where you can spend that time interacting with your baby, talking to your baby while they're eating, just like you would be having a conversation with a friend or a spouse or whoever across the table. They're eating. Have that conversation, talk to your baby, read a story to your baby, I mean,
you can just even monologue what your day was like. Oh, today I went to work, I was missing you, but I got to talk to this person or so-and-so. How was your day? Absolutely.
Yeah, that's how babies learn how to have a conversation. I mean, at first they're very one-sided, but eventually they will talk back to you.
And they sure will.
One of the other things I want to talk about before we move on from bottles is a lot of people talk about nipple confusion. And I think we should speak to that a little bit because babies don't get confused.
They're smart. They're much smarter than we give them credit for.
Sometimes a baby can be refusing a bottle because they don't feel that closeness with you. Something that can really help early on is still doing skin to skin, having that skin to skin contact with your baby, even if you're feeding from a bottle. And that's something that I definitely did early on with my son because we were bottle feeding. Getting him on me skin to skin, holding him in a very natural position and using that natural flow. One of the things babies really like about bottles, especially the big nipples, is they can get a lot of milk really fast and they don't have to work as hard for it. So that can create a little bit of that issue where now they don't want the breast because they have to work harder. They're like, no, give me that bottle again where I can just suck it right down.
Right.
And that's not your baby being confused. That's your baby being smart.
Yeah. And again, it's just really different mechanics in the mouth as well. And so for, as I'm sure plenty of people out there know, you can't force a breastfeed baby to breastfeed.
Right.
There are plenty of people who will sit and cry and just, please just nurse right now, right? For various reasons. And it's really something that a baby has to actively engage in. Whereas with a bottle, if I was going to stick this in Jessica's mouth, it's going to drip naturally. And so to prevent choking, she's going to naturally swallow because she doesn't want to choke. That's just kind of priorities of life, right?
I don't.
But what's important to remember too is that because the mechanics are different, that's not necessarily, again, confusion. It just might be that, again, there's some challenges or perhaps just a preference for a particular way of things for a baby for, again, a multitude of different reasons. So the point is, if you're finding that, there's a struggle with one thing, both things, the other, whatever it is, there are definitely resources out there that can help you. I mean, as lactation professionals, there are people in the hospital. Sometimes pediatricians are also kind of savvy about feeding, but maybe not. And I know that's a place that a lot of people go to. So talk to your provider, talk to your pediatrician about what is their experience? Do they have training specifically around feeding? And if not, perhaps they have a nutritionist or someone on staff. Also, early intervention. I cannot stress enough how incredible early intervention services are. They're a free service that is available to anybody 3 years old and under. You just have to qualify. And so if you have a concern, just give a call. I know locally towards the Hampton area, there's Richie McFarland Children's Center just over in Stratham.
In Dover, in our area, in Dover, there's community partners and they are amazing.
Yeah.
My son had speech delay and they have been fantastic, just really helpful and tons of resources there.
Definitely. And so there have specific training to, occupational therapy, physical therapy and things that can really assess and say, what, your baby is struggling with a bottle, not because they're trying to be difficult, but perhaps because there's, some discoordination or perhaps there's tone or what have you.
And sometimes it's positional where something like craniosacral therapy might really help. There might be something that you could go and see a chiropractor. Maybe baby needs an adjustment, especially early on. They were really cramped inside your belly.
Yeah, when they're all,
they come out, they're all squished up. So sometimes, and even birth can be hard on a baby's body, and they might need an adjustment or a few adjustments to kind of work some stuff out and make them more comfortable when they are feeding, and that can be at the breast or with a bottle.
Absolutely. And so I just wanted to kind of tie back into when we were talking about our childcare providers. That's where it's really important, again, just to kind of have a conversation with them about, like, have you thought about paced bottle feeding, or how do you generally like to manage if there's, maybe 4 babies who are all needing to be fed at the same time? How are those things kind of interacting? And really have a really honest conversation about what your concerns are, because if you're at work and you're really worried about, is my baby eating enough food, or how are they eating their food, that's a stress that really can try to be mitigated. I didn't mean to interrupt you.
No, I wanted to talk a little bit about pumping and what you might see on Facebook or something like that versus the reality of how much milk you're going to get when you pump, because a lot of people will post these pictures of these full bottles. Look how much milk I got. This is amazing. And sometimes you don't pump that much milk, and that's okay. You have to remember, when your baby's breastfeeding, they're going to be much more efficient than your pump. No matter how good your pump is, your baby is better.
As long as there's a good latch and as long as there's like effective milk transfer. But once they get that down, they can be really effective.
Right. And your pump is mechanical. You're not going to have the same hormone reaction with your pump as you're going to have with your baby. So there's that too. So when you're at work and you're pumping and you're trying to take that 15 minutes and pump, you're also stressed. So what do we need to do at work to decompress, to be able to let the milk flow more naturally? A lot of people will use pictures and videos of their baby, that listening to those baby sounds. I've even known some moms who have brought something that smells like their baby, just like your baby likes things that smell like you respond to things that smell like your baby. So those can be things that can help you just take a breath, relax, and help your milk let down.
Does anybody have any tips or techniques that have worked for them? I know I definitely, when I was working in pumping or when I'm traveling and training, I would definitely get videos, because it's like, if you can kind of trick your body into having some of those more sensory experiences, it can be, again, that whole love hormone, that oxytocin release that you needed during labor and delivery. You need that as well for just like that release of milk to happen. And so there can be plenty of milk in the breast, but it can be sometimes really hard to like just let it out. One of the things, so there's a couple of different kinds, but one of the things that's become really popular is this. Do you want to talk about that?
Yeah. Do we have a breast?
No, I can get
So
one.
this is a Haka, and it is silicone. It's very pliable, squishy, and it's got this great.
We always have boobies here at Relief Parenting.
It's got this great suction cup. And something I didn't know when I originally saw these is you're actually supposed to fold it back. I don't know if you can see it, and put it on the breast, and then it'll suction on, and it just has a gentle suction. So when you're nursing on one side, or maybe you're just pumping on one, it can have a gentle release of milk on the other side and catch all that stuff that you might not get when you're nursing on one side. You might be leaking from the other. Well, now you've got all that milk. And I would suggest they have ones with a suction cup on the bottom. I always recommend the one with the suction cup, so this doesn't fall over when you put it on the side table, and because that milk is worth crying over.
It totally is. Well, there's like a meme about, if you've never cried over spilled milk, you've never been a breastfeeding mother. Yes, it's true.
That is true.
So true.
I think every mom that I work with has one of these or two of these. They are worth their weight in gold.
Has anybody had one throw out a heart or or something like that?
I was saying these were just after my time at pumping and breastfeeding, and I was so sad when I saw these come. I was like, these would have been amazing. And you will see a lot of milk collect in these.
And it's pretty incredible too, because again, that negative pressure that happens there, you really don't have to do any work, and that can feel a lot less cumbersome. So there's so many different kinds of pumps out there. Pumps again are still covered by insurance. So if you have medical insurance, you can make sure that you have access to getting a free breast pump. So this one is Linsno, but it can feel a lot less cumbersome to try and collect milk with something like a Haka pump versus trying to, kind of put one on this side, and then you're trying to latch baby on, and or perhaps they're this
turn
way,
the machine on,
and then they're kicking at it and things like this, and it can feel a little cumbersome. Does this work? And if you have one, yes, absolutely. But yeah, pumping can be really challenging. And so another thing I always like to joke about is, if you feel like your pump is talking to you, that's okay, because there's a certain sound. It's like whoosh, 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 that kind of stuff.
You'll start hearing it in your sleep.
You will start to hear it. And people will joke and they'll say like, oh my gosh, I feel like my pump is talking to me. And I will say it's absolutely fine as long as it's saying something positive. So if it's not saying something positive to you, shut it off for a second, think about something positive, and then turn it back on. So it could be like, more milk, more milk, more milk, versus something else. Like, you got it, you got it, you got it, whatever the phrase is. But like, find a little mantra and have your pump encourage you with that little mantra versus anything else.
And if you are going back to work, it's really important that you're comfortable using your pump before that first day. Definitely practice at home. Make sure the flanges are the right size for you. That's something a lot of people don't know, is that they do come in different sizes. So make sure that they're comfortable for you, that they fit you well, that your nipples aren't rubbing on the inside of them, because that will get really uncomfortable really fast.
It definitely does.
And that cranking it all the way up isn't necessarily what you need to do to get the milk out. That's not necessarily going to get more milk out or get it out faster. It's a natural process, and you have to let your body do what it does. So you can't really rush it out or
crank it up,
vacuum it out faster.
No, that can actually create the opposite effect, right? Because then we're in that pain response, and pain doesn't equal that love oxytocin hormone stuff. So.
And it equals stress, and then you're not going to be excited about pumping. Environment has a lot to do with it too. So at the hospital where I work, have a dedicated lactation room. I don't know what other people have out there at your work, what kind of rooms you guys are in. It should be a private space. That's not a bathroom. Your employer should be providing you with that. There are laws that they have to follow. So we have a nice comfy room, and there was actually a hospital grade pump in there in case you needed it, which is really nice.
One of the perks of hospitals.
One of the perks of that. But tell us about your environment at your work. Where are you pumping, and is it comfortable for you? What have you done to make it comfortable? I know a lot of the women, they bring in little things just to make it a little more homey.
Absolutely.
So there's nice comfy chairs.
Someone has a question saying, what are the benefits of breastfeeding compared to formula?
Oh, that could be
that's a really tricky conversation.
Yeah, that could be like an at-length conversation. Essentially, though, we'll break it down into just like really basics. There's an enormous amount of health benefits for babies, including lower risk for ear infections, GI issues, obesity, type 1 and 2 diabetes, food allergies, environmental allergies, let's see, I'm missing different childhood cancers, so on. So, and these are kind of lifelong benefits, which is really important. Also, just on a day-to-day type of basis, the body, because it tailors the milk specifically to the needs of your baby, the breast milk, the content changes every single day. And so if, for instance, there's a lot of colds or things going around, or as you're going into a daycare setting, I always encourage moms, like, just touch everything. Like, go through the room when you're into, going into the childcare space, go in a week or so beforehand and just like touch all the things. And you don't need to like go home and lick your hands or anything.
Please don't do that.
But what you can do is just kind of naturally, you're going to be picking up on those different germs that are out in our natural environment. And then what's really incredible is your body will then turn into creating antibodies. And as you're breastfeeding, you're passing those antibodies on to your baby, and that can kind of help mitigate a lot of those illnesses, which are great. On the flip side, for moms who are breastfeeding, There's a return to pre-pregnancy weight, usually more quickly than if not breastfeeding. The uterus contracts, and so it helps kind of bring in those just the muscles and so on and so forth. Also, there's that oxytocin rush. So again, it can kind of help with creating a bond and an attachment to your little one.
Lowers the risk of certain cancers.
Lowers the risk of certain cancers, such as breast cancer and ovarian cancer, also diabetes, heart attack, and I know I'm probably missing something, but overall, there's an enormous amount of health benefits. In addition to that, just from a financial perspective as well. So we were talking about kind of what are your illness policies at work, and if you've got a little one who perhaps has ear infections or things like that, that can start to really add up, right? Because not only are you taking time off of work and then you have to go and bring your child to the doctor, and that has a copay, and then you need to get medication and so on and so forth. So there's definitely a financial side of things, because formula can get really expensive very quickly, especially if there's food issues and intolerances. You can be looking at sometimes upwards of like $50-$60 each can, and that goes really quickly. And so there's, I mean, seminars and workshops and like enormous coverage that goes into this. This is people's life work about like why there's benefits of breastfeeding.
And I would say if you are formula feeding, or if you are planning to formula feed, you should still talk to a lactation counselor about how to safely feed your baby formula. There's issues with introducing bacteria into the canisters themselves, which is better. You know, should I make up a big batch and do it like that, or should I do it individually? And there are different ways to kind of navigate that, and lactation counselors can help with that as well. So even if you're not planning on breastfeeding, you should still reach out to those people and kind of find out the best way to do that for your circumstances.
Yeah, and I always want to say too, you know, as much as we want to be proponents of breastfeeding, we understand that we are working in an environment and in a culture that really makes enormous barriers for breastfeeding success. And so if you are formula feeding, you're doing the best that you can, and that is absolutely okay, and we are here to support you in that. And I tell every parent all the time, it's got to work for you. And so I just always wanted to preface that as well.
And that kind of leads into one of the subjects we wanted to talk about, which is the work guilt balance. There can be a lot of that when you're going back to work, or when you're taking any time away from your baby. You can feel really conflicted with, oh, this is so nice to be away from the baby. And then you immediately feel that, oh, I shouldn't feel, no, it's okay to feel good about being by yourself for 5 minutes. I know when I went to work, back to work, it was hard. And I was leaving my child with my husband, who was very capable. It was still really difficult to go back, but it was also really nice to just be Jessica again, and not be mom, and not be, you know, the woman on the couch with the baby at her breast, and just to be able to be a woman again outside in the world, talking to adults about adult things, not talking about poop and spit up and
yourself.
You know, to have those interactions and joke around with people about, you know, just all of it, and just kind of getting back to kind of, you'll never really get back to your old self, you know, there's always this new factor in your life, but kind of getting back into that work routine. And then you can feel guilty about that, about enjoying being away from your baby. There's nothing wrong with enjoying being away from your baby. That's okay.
As I probably has said maybe last week, I'm a big fan of Daniel Tiger, and Daniel Tiger has a song for pretty much every life lesson. This one reminds me of, sometimes we have two feelings at the same time, and that's okay. And it really is. I think that just describes parenthood in all stages of parenthood, right? I mean, like, we can simultaneously want to be so close and loving with our babies, because they're part of us and we created them, and oh my gosh, isn't it so incredible? But it's also like, oh my gosh, I'm really touched out, and I want to have, like, just recognize that other part of myself. So I would love to hear from some of you as well. Like, what are some of the biggest challenges that you that is like faced, and also what are some of the positives from returning to work, because you can have both, and you can have both simultaneously, and that's really normal. I know that even for myself, even though I've tried to really strive to create a space where I can be with my kids and interact them, like we talked about earlier, having the on-premise childcare here, there are still times that I'm like, oh my gosh, I feel like I'm not doing my best version of my work self, and I'm not doing my best version of my mom self, and I'm not doing my best version of my, being a partner or a friend. I mean, but we have to have some compassion for ourselves as well. And I think that's one of the biggest challenges, and why we want to have a group like this, is to remind you that it's okay and all of your feelings are valid. And it's hard to be a parent, and we just want you to know you're not alone with that. And that's really,
and we're here to talk. If you need to come in and just say, I need to talk to somebody about this, even if you just want to come in and be around other moms, and this is
and other dads
for
too.
Other dads. I mean, come here, come to one of our groups, just be in the space, be with real people, be with parents that, on Facebook you see everybody's perfect life and all of that. Things aren't perfect here. Things aren't perfect anywhere, and that's okay. And that's what this space is all about, is letting it be okay.
Absolutely.
Do we have a question?
It's kind of off topic, but what menstrual products do you suggest as a better alternative to pads and tampons?
Let's table that for a second. We'll come back to that for sure. Let's kind of finish some of the conversation about working, because when we're talking about being away from home, trying to figure out daycare, trying to figure out, pumping and feeding our babies, and then, oh, by the way, you also have your period. It definitely warrants conversation. Because that does happen. So one of the other things, before we kind of switch gears a little bit, another situation that oftentimes parents will find themselves in is their priorities kind of shift, right? And they try and kind of, again, figure out different alternatives or different flexible schedules and things like that to try and meet their new priority needs. And sometimes that means working from home. And so if we have anybody, again, kind of tapping in right now about, like, are you at home? Are you trying to do some of your work at home? Or what does that look like? And how has that experience been going? Because that can be sometimes the best of both worlds. And sometimes you can feel like you're just getting stressed from all angles, because I think there's definitely a perception of, oh, well, if you're home, you're still going to be able to really engage with your child and be really involved in that, like, quality, like we were talking about. But at the same time, you also have the exact expectation of that for your work self, and you still might have really clear things that need to be done on a daily basis.
I've actually worked with quite a few families and had a few friends whose husbands or partners work from home. And so their family or friends have the perspective that, oh, well, you have somebody else home with you. No, that person is working, and they're often in a very separate space and not available for you. They are, I mean, if there's an emergency, obviously, just like if they were at work, but they are in their own space. And if you're thinking about working from home and you haven't started that yet, I would definitely suggest setting up a separate space that's just for work, that's like your own little cubicle or whatever it looks like, whether it be in a separate part of the house, if you have an office in your house, but that's only set up for your work, and that it's not also a playroom or also, a guest room if you're going to have guests a lot or something like that.
And it can be really challenging too, because I mean, there are some times where that's your only option, right? Is to kind of simultaneously be doing your work, your, paid employment, while also with your little ones. And sometimes that's just the only thing that you have as an option, and get that too. And so how to try and navigate through some of that can be really challenging. One of the things that I have definitely done over the years is I'm like, oh, well, I'll kind of work when my baby is asleep, or after my baby goes to bed, or things like that. And if you've ever received an email from me, you'll probably find it's from like 10, 11 o'clock at night or so. And that can work for a lot of people, but also kind of coming back to the idea of that's not necessarily sustainable long time.
Right.
And so how do you then kind of make sure that you're taking care of yourselves? And part of relief that we've created here too is an opportunity for work sessions as well. So utilizing some of that on-premise childcare, so you can go into a private space or you can go into a quieter area, have a desk, have a designated space that you can just kind of bust out what you need to, or make a phone call, or so on and so forth. And we've had people utilize that with really great success. Somebody can come in and they're like, I have my employment where I go to work, but I had a day off, but I have this huge deadline and I was here for 2 hours, but honestly, I got more done in the 2 hours than I would have if I had gone to work for a full day, because nobody disturbed me. My coworkers, my kids, my family members, like it was just a designated space.
And you're not at home thinking about the laundry or what you're going to make for lunch or all those little things that can distract you at home as well. So if anybody has been working from home and has any tips for somebody who may be thinking about doing that or is about to transition into that, definitely leave them in the comments. Leave all your little tricks, all the things that worked for you. I have not worked from home on a real professional basis. I've done little side things from home, but nothing that I had deadlines or really had to be on task at a certain time for. So it was really flexible for me. So I haven't had that personal experience, but I know a lot of people who have worked from home and had different challenges, definitely, with the interruptions, especially with older toddlers coming in, and they're like, but why can't we play right now?
And I think it goes back to that kind of boundary setting up as well, that I think everybody needs to practice, right? Sometimes we're really great at setting boundaries and other times not so much. But really
day to day.
Yeah, it's really, it's all over the place. I know for me, and I'm sure I'm not the only one. But yeah, kind of setting up like, okay, what's the expectation if I'm going to be working here? Or what's the expectation again for if you're bringing in a childcare worker to your home and you're also working from home? And that's valid too. I get a lot of people who feel really guilty about bringing in childcare providers as, a nanny, as, part-time, whatever, even if you don't have outside employment. And so even people who are full-time parents, you still need and deserve a break too. And that is absolutely okay. And so I think just we all struggle with those expectations of, well, who am I? How much of this is associated with like who I am as a person? How do I do these jobs? How do I kind of just navigate through all of those different parts of myself? And that's why I think it's always a really great idea to be able to connect with other people and just say, this is where I am right now. This is what's working for me. And this is definitely not working. And what do you have to say about it? What works for you? Because the more that we can kind of be in community together and the more that we can be authentic about what our experiences are, hopefully that makes it easier for people in the longer run.
Right.
Yeah. So of course, keep bringing your questions or any concerns you have in terms of work and employment and parenthood. And again, I think sometimes it changes as well with as your children get older and how those priorities shift. But the great thing is you can always try and reassess, and you have different resources available to you to make it work for your family as best you can.
So we have a few minutes left, so I think we should address the question, and then we will tell you about some things coming up.
Yeah, we've got a bit of a surprise offer for you, so stay tuned for that. So to address the question, can you maybe perhaps read it again?
What menstrual products do you suggest as a better alternative to pads and tampons?
Do you want to jump in? Or you want me to jump in?
I don't have any experience with anything besides that, so I actually don't have any suggestions for you.
I sure do. So there are some really awesome things called menstrual cups. At the center out in the front, we have a variety of different samples, but one of our practitioners here, Adrienne, she talks at length about menstrual health. That's her whole business, and helping to educate and empower people about that. And we have menstrual cups out there, and essentially what that is it replaces either a tampon or a pad. And it's essentially a small silicone bowl, and you fold it and you're able to insert it. And what's really incredible about these is that it has a huge impact in terms of finances. So you buy one cup for roughly $30 or so. It can last you upwards of 10 years as long as you're, again, sanitizing and washing appropriately. That also has a big health impact in terms of what's going into your body. So tampons, again, especially if they're bleached, there's different chemicals or things. And sometimes people will say that, tampons, my body just hates them and I feel really crampy and really uncomfortable, or, doesn't work for me.
Right.
And
there can be
that's
certain times of your period where they're more comfortable than others, or you're like, I don't, I'm done.
And so that's, again, your body's telling you something that it's just it's not the right thing for you. And then from an environmental perspective, again, by using this one cup, we're reducing enormous amounts of environmental impact in terms of, water usage and the plastics and what happens to our pads and our tampons when they are then put into a landfill or, end up in the ocean. So menstrual cups are a really awesome alternative, and they can be a really easy thing, kind of tying back into our conversation going back to work, because they also can be put in and you can wear them for upwards of 12 hours. And so oftentimes women who are using menstrual cups will kind of wake up in the morning, empty their cup, wash it out, put it back in, and then you don't have to do anything until you're about ready to go to sleep at night. And I've personally used menstrual cups since I was in college. And so I got married. I had my period when I got married. And so I had a menstrual cup on my wedding day. I traveled.
Oh, lucky lady.
I know.
Oh, yeah.
And I traveled across, the country and then the across the world to New Zealand. So I was on these really long legs of flights with a menstrual cup in. I went hiking and so on and so forth. And so they can be a really cool, very beneficial thing to use. Before I answer your question, we're actually going to be having 2 upcoming workshops around menstruation. One is specifically about menstrual cups, which is going to be great. That's coming up in October.
I may have to go to that. Yeah.
Definitely. It's a really fun, just silly, ask all those questions and, get all those tips and things that you might be too nervous to ask in like an online setting. And also we're going to follow that up with talking to your daughter about menstruation and what that looks like and how you kind of broach those subjects and talk in an age appropriate way, help her to get set up about kind of taking care of her body and so on. And so those are going to be coming up.
Huge, because if you're uncomfortable, she's going to be even more uncomfortable. I remember just my mom, I don't want to talk to you about this, but she didn't want to talk to me about it either. She's like, here's the pamphlet, there you go.
Yeah, but then when you're trying to figure out like, okay, well, how do I use this pad or this tampon or this cup? Like,
what?
So
what
we can help you with that, right? Yeah. We're providing relief on a number of levels here.
Absolutely. So one of the things that I was going to say is I've been interested in the cup because I find myself not drinking as much water when I'm on my period, because then I have to pee every 5 minutes, and every time you pee you have to change tampon, and it's like, okay, enough. Like, I'm done. So I just don't drink enough water, which is terrible.
That's like one of the number one health things you can do, right? Is drinking enough water.
And then you feel worse because you're dehydrated and you already have your period, so you already feel like garbage. It's like just compounding the issue. So I will definitely be at this workshop.
Nice. You will definitely not be the only one. And there's lots of fun questions. And again, it's a chance to kind of really interact with the different cups and see, like, what is this all about?
Right. And what's going to work for you.
Yeah, definitely. So the last thing, as we kind of wrap up, I wanted to say thank you. Thank you so much for liking us. We have reached over 1,000 likes on our Facebook page. Yay! It's really so incredible just to know that we have reached that many different people in our community. And so I just want to say a very heartfelt thank you for supporting this whole idea, this mission of bringing parents together, helping to know that we can be authentic with one another, that we can support one another, we can have the education that we need, and that we really deserve to have a break. We really deserve to have all of these services and things available to us in our community. So thank you very much.
And we're really excited to meet you guys. If you haven't been in yet, the 21st of September is the 1-year anniversary birthday party for Relief. So that would be a great time if you haven't made it in to come in.
Yes.
We're doing a brunch and bumps event before that.
Yeah.
So for anybody who's expecting, come in before that from 9 to 10, and we're gonna have brunch and bumps, and then after that is a big birthday bash.
Yeah, so we'll be able to kind of talk with the different providers who are here. We're going to have different raffles and activities, and as a way to say thank you for helping us to reach those 1,000 likes, wanted to offer a little discount for today. So today, if you call our center and let us know that you would like to come in for a class, for an appointment, for something that's going on here at the center, a respite room or a work room, call our center today and you'll get 10% off. You have to call today. We close at 3 o'clock, so make sure you share this around with people. But yes, we would really love to just say thank you in a really tangible way. So please come in, join us. We would love to just, again, give and share our thanks. So you can reach us at 603-910-5497. And if you call today by 3 o'clock to book a session or a class or an appointment, then we will be sure to give you that special discount. We will be back at it again next week, next Wednesday, so we hope you'll join us again then.
Yep, leave your comments and questions, anything that you want us to talk about next week. You can leave it on the comments of this video and we'll check back and we'll address it next week.
Yeah, and we hope that we will be seeing you live on Facebook and in person again soon. And thank you again so much for joining us. Enjoy the rest of the day.
Bye.
Bye.